video that I'm doing less than a day later. Normally I do every video one day after the other, so there's like 20 plus hours in between. This is like less than 20 hours. It's probably more or less than probably less than 10 hours. This just covers a sort of basics in pain relief, be it chemo related or cancer related, because you get all these side issues every so often. And I'm going to mention some things to do with paracetamol, like alternatives, not the bog standard version, which like ranges from like 30 pence to 50 pence for a standard box. It's like a generic paracetamol. You get it from even small supermarkets. You can get them, and no prescription needed. And they all basically look the same and operate the same. So I'm not going to go on any more than that on that issue. I'm going to cover the two things that a lot of people aren't too familiar with compared to standard paracetamol. And the first one is that one. And this is pronounced Ibuprofen. This is made by a company called Heritage, but I assume there's many more alternative makers. This is states it's 200 mg per tablet. Mg means milligram. It's a metric measurement. There's 16 in this box, so maybe other boxes by other companies are the same or similar. And the reason why this is good is that if you don't get on too well with paracetamol, like a negative reaction, or it just doesn't do anything, at least there's an alternative. But what most people don't know is that you can combine this ibuprofen with standard paracetamol to help, rather than just do the same thing, and it won't count as an overdose. So you're not meant to take any more than you should for this drug, as well as paracetamol, which I think is like 4 tablets every like let's see, I suppose it's every like 8 hours, I think, something like that. They're all like similar in shape and weight from I've seen. And so you're not going to go beyond that, even though you might feel you need to. And though you can't medically, you can get around it by combining ibuprofen with regular paracetamol, which I didn't know until a few weeks ago when I was told at hospital. So now you know, without having to go to hospital. You still can't exceed the maximum of either type, but at least you can get more pain relief rather than none if you really need it, without the situation of like self-drugging going too far. Well, I mean self-medication, I should say. So this is like a standard version of it. It's like different versions, but they all do the same thing. And it's for all sorts of pain relief. Yeah, it reduces inflammation, which is kind of true of cancer. It's like cancer is like something becoming inflamed and therefore bigger. It says a lowest temperature, which is like useful if you've got like a negative reaction for a short period of time. If it's like beyond a short period of time, you may not consult a medical person because then it's more serious. And it says a relief of rheumatic aches and pains. You get a little bit of that. Let's see, colds and flu symptoms. Well, that doesn't really apply, at least not in my situation. But I suppose if you ever did get it, then it would help. And there's like backache and fever, let's just say it's fever. And I suppose that's connected to like body temperature, which I've heard could go up. Backache, not really, but you never know. Let's see, migraine or migraine. Maybe cancer or chemo could trigger that if you've already got it. Headache and nerve pain. Well, I think headache is a good thing. You might get a lot of stress when you're in the waiting part for having chemo or some sort of diagnosis, and that could like cause a headache, even if you don't expect it, or you don't get them very much. Or you could get a headache after the process due to all the physical and mental stresses, so that could help. There's also do's as well as don'ts, which is on the back. And you're not meant to take it if you've got like asthma, liver, heart, kidney or bowel problems, unless you consult a doctor beforehand. So I'm not saying you shouldn't do it, but it says on the back you got to consult a doctor if you reckon you do have those problems. So you don't have to worry about losing out and not being able to use this, because you've got to like take a consultation moment out of time and to get like a proper medical opinion. And it says you're meant to take it after food, as in like after having dinner or lunch. I don't know if breakfast counts or a snack, because that might not be very substantial, so maybe that won't count very much compared to lunch and dinner, which are bigger meals. Or maybe any food counts. It doesn't say the size of food, which I know for a fact can vary, so maybe it should say that in future packaging redesign moments, just to clear the air sort of thing. Anyway, that's ibuprofen, and I've used it a couple of times. I don't often buy it compared to standard paracetamol because it's more expensive. I think it's like double the price, maybe triple. Yeah, I think it's either double or triple the price, even though it basically does the same thing. So I tend to do standard paracetamol, therefore I recommend that. But like I say at the beginning, I mean the early part of this video, if that isn't so good for you, then do ibuprofen. It's the next best thing, and it's not too expensive. In the UK, I think you can get it for £1, maybe a bit more than £1, and maybe in like America or Canada, maybe it's like $1. I don't know, $1 plus. That's my guess. Right, that's it then. That's it for this one. Ibuprofen. It's a general drug, so I'm not saying it's just for cancer or just for chemo. It's for a bunch of medical reasons, and because it's sort of generalization, is what it can do, rather than being specific. If you've got like cancer, or you're undergoing chemo, well, it might be useful, ibuprofen. I've had it like a couple of times since I got diagnosed with cancer, and I think once after I had chemo, when I had a bad spell, but not very bad, but bad enough to take it. Yeah, so I think I did it like a trio of times when I had cancer, when I realised I had cancer, and then once after I had the chemo treatment. So not a lot really, because we're talking like a period of maybe 3 months have elapsed since I got diagnosed. So 3 or 4 times isn't much, but it's good to have it around, and they're easy to find. You don't have to go to a pharmacy. You go to virtually anywhere, maybe even a corner shop. I think even a corner shop might sell. So I think I've seen them in a corner shop a few times. So anyway, there you go. Nothing more to say, and that's it for this moment of the day. I might do another one before midnight. I can't say, but I might. So that's it. That's it for the moment. Bye.